Hi and welcome to Steps to Strides with me, Connor Ratcliffe, and we're back in the garage gym today looking at some potential loading strategies for our tibialis posterior. Now today's exercise is a seated double limb tiptoe raise modified for tibialis posterior, and similar to some of our weight bearing exercises, we're going to look at quite similar cues, essentially targeting the same structure, so kind of makes some sense. So the cue we're going to be looking at today to make this a little bit more biased towards tibialis posterior and really getting that plantar flexion inversion and engaging that frontal plane action at tibialis posterior is that we're going to look at loading the fifth. So we want all the pressure over the little toe, all the pressure over this area, and these are the sort of cues that I'll use in the fancy term verbal augmented feedback. And again, you can kinesthetically cue, so we can press, feel it there, feel it here, all these sorts of strategies to make sure that we're getting our desired result, which is making the exercise a little bit more specific, a little bit more targeted, and actually achieving what we want it to, which is, in this instance, biasing the load towards tibialis posterior. So, because we're in this flexed knee position, it makes gastrocnemius one of your big, powerful calf muscles and plantar flexors actively insufficient. Now tibialis posterior has plantar flexion as its sagittal plane function as well, which means essentially we take something away, we make everything else that's left have to work a little bit harder. So because we're in this seated semi-weight bearing position and we can modify knee flexion, we can make tibialis posterior work a little bit harder, especially in that sagittal plane action. Now, the further we put our foot back and the further we increase the knee flexion, the more we'll make gastrocnemius actively insufficient, but we also put more stress and more stretch through tibialis posterior as it comes around medial malleolus. So it makes the foot more relatively dorsiflex to leg. And if we move it out and we stack it underneath tibiofemoral joint, knee, then you can see that there's less range of motion, and again that's an easy modification and tweak to either make it a bit harder or a bit easier, or if you're less concerned about the sagittal plane and just really want to work on frontal plane, then you might set them up in a relatively plantar flexed position, so in front and foot in front of knee more. So it really just targets the inversion as long as we're getting that load under the fifth. So, nice easy setup again, and if we want this as kind of an easier exercise for our patient and a built-in regression, nothing else to do, just sit in this position, modify the foot position to your patient's tolerance, and then we're going to come up for one, hold for two, down for a count of three in our typical 1, 2, 3 second tempo, which biases the eccentric phase. And for tib post, that's really useful, as I'll mention in the videos, but the eccentric portion of its contraction means that that's the bit that decelerates eversion or pronation throughout gait. So as we come into initial contact and the foot whips over into full contact to mid stance, it's an eccentric contraction that's decelerating the frontal range plane of motion. So we're going to come up for one, hold for two, down for a count of three, and we get all those aforementioned benefits of the eccentric contraction and the benefits of just putting more load through tissue and initiating more tissue change. So we're going to up for one, feel the pressure underneath the little toe, feel the pressure under the outside of your foot, under the ball of the foot, feel the pressure here, whatever we need to say to make sure we're getting that engagement and more inversion. And then down, nice and slowly for count of three. Up, down, nice and slowly for a count of three. So in this position, we don't actually put too much load under forefoot, but like in some of the other videos where we're full weight bearing, so modified double limb, single limb tiptoe raises for tibialis posterior, just be aware of overloading forefoot and doing this on a nice soft mat, or you can do it in trainers, but that will modify exercise and range of motion a little bit. If I want to add a bit more resistance to this, without adding external load with weights, then I can get my patient to lean forward. And the cue I typically use here is go into the position like you're about to push and stand up. So they're pushing down on their knees, which is going to add a bit of extra force and resistance. When they come up into that tiptoe raise position, feel the pressure under the fifth and come down nice and slowly in the eccentric phase. Now, if we really want to progress this, then we can modify the range of motion, sure, but we can add external load and we can look at some heavy slow resistance work. So we've got our dumbbells here. Now the position of our dumbbell on thigh will matter as well. Further forward we are, the more of a moment essentially it will create, because we'll increase the weight's kind of lever arm relative to hip. So when it pushes down, there'll be a bigger force. But don't worry too much about that. Just another variable to consider. So we're up, dumbbells resting on thighs, and then rinse and repeat. There's no other change, same cues. Make sure the foot position's appropriate and you've got as much sagittal plane range of motion as you want. And then we're going to come up, feel the pressure underneath the little toe, underneath the ball of the foot, outside the foot. Come down nice and slowly. Up, pressure in the little toe, really force calcaneal inversion, and down. And then make sure they can get the weights off. So that's our seated double limb tiptoe raise modified for tibialis posterior.